Welcome to the Project Censored Night at Aqua's Cafe. I'm Peter Phillips from Project Censored. Mickey is not available tonight, but so I'll be emceeing and helping out. I'm also the instructor for our program tonight, which is student researchers in the Social Justice Investigative Sociology class at Sonoma State University. So think of investigative journalism with a little more depth and facts and research that go along with it. So that's the idea of this course. Students come, they work in research teams of 4, 5, or 6 people. They pick a topic. Our topics this semester were rental housing crisis in Sonoma County uninsured health issues, and immigrant rights and DACA sanctuary cities. So those topics will be presenting tonight, the research, but this isn't that they just go out and interview people. The first thing they do is build a journal, a really big 100 to 200 page reader. That is all the topics everything that we know from newspaper articles or social science research about the topic. That's their textbook. So there's no textbooks, they just have that as a textbook. And we meet as a class maybe once a month. But most of the time I meet with them individually in their groups during the class each time. And then our class was Wednesday afternoons. So their first task is to read all the material about the issue, come up with a research question, because investigative research is about finding something new. So they're going to say, well, what do we want to find out new about this topic? And it wasn't been disclosed before. And so that's part of what they're doing. And then they have to come up with their research methods. How are they going to determine that? So in these cases, it's often interviews, observations, sometimes questionnaires, to come up with data. And then they can say, this is new information that we're presenting, and that's what they're doing here tonight. So I'd like to welcome our first team on rental housing crisis in Sonoma County. Kendyl Sacby, Iyla Knight, Natalie Marquez, Emi Sides, and Kristina Jaco. And Ross Galeto is not here tonight, so welcome.
All right, so the purpose of our research is to discover that millennials are facing in regards to affordable housing. This topic is extremely important to the entire community, and the issues surrounding the housing crisis have been well documented. Millennials share an important role in our community, and it is important that they are able to afford to continue to live here. If our county does not take action against the housing crisis, we will lose an important generation of citizens, including students and young families, to provide diversity and individuality to our community. As we know, the housing crisis in Sonoma County affects many people on many different levels. Having a major university in our county, students are of course majorly affected by the housing crisis. The average students make only minimum wage, meaning for them to afford a 1-bedroom apartment, they would need to work 89 hours a week. The majority of students that I interviewed all had issues finding and affording housing, not to mention school expenses as well as their other living expenses. Students talked about the issues they face daily, from limiting their driving to save on gas, as well as being conscious of when buying food out, as well as unnecessary monthly spending. One student shared that she had even sold clothing as well as other items to generate spare cash. Another had uprooted her life, moving from Moner Park to Petaluma, moving into a studio apartment on family property to help save money and pay off debt. The amount of stress that students are facing on a monthly basis around paying their rent and bills is having an overall negative impact on students' mental state as well as grades. Thank you.
In 2016, a study marked Sonoma County as the 15th county where renters had felt weighted heavily on how much money citizens had to pay for housing. Many of the families that are able to afford expenses of living in Sonoma County are retired couples. An average of 40% of homes intended for families are owned by a single individual, who in most cases is retired. The problem isn't finding space to build more homes, but rather raising wages of people who are not paid enough to afford housing in Sonoma County. I had the chance to interview a 24-year-old single mother of 2. She constantly faced the burden of the high rental prices in Sonoma County. 60% of her income goes directly to rent, as her rent continues to increase by $200 to $300. She mentioned, "It is hard for single parents with only one income because even though they work, a lot of assistance programs will say they make too much income and won't help. This is a reality many families experience in Sonoma County."
So I also interviewed a few young families, and I'm going to share some of the details that stood out to me. So the first family that I talked to is a young couple that lives in Roanoke Park, and they have 2 small children under the age of 10. And they both have full-time jobs that have benefits, and they actually have a pretty affordable rent. For a 3-bedroom house, they pay $1,800 in Roanoke Park. They've been there for 10 years, but they do face some challenges with their landlord. They have quite a bit of black mold in the house, and just a few weeks ago, she was explaining to me that her daughter was coughing, and she was cleaning her room and noticed that there was black mold underneath her daughter's mattress. And she's scared of confronting her landlord about these issues because they're afraid they're going to get kicked out of their house and not be able to afford true market rental prices. When I asked her about the difficulty that she faces living in Sonoma County, she said, "We can't afford to buy in Sonoma County, and we have really reasonable rent for a single family home. We've lived here for 10 years, but for us, it's not that difficult to live here, but it's certainly difficult to thrive here and starting to build equity in the county." So she can't afford to buy a house, and so that was her issue. The second family I interviewed is a young mother of 2 living with her partner in Sebastopol, and they rent a condo that her mother owns, and so they also kind of lucked out in the rental market and get a discount on the condo. They both are well educated and well paid, but they too don't see a future buying a house in Sonoma County. And she's quoted saying, "It's becoming increasingly difficult due to the cost of living. We moved out of the East Bay because we wanted to raise our children in a family-friendly community, and we couldn't keep up with the cost of living in the East Bay. However, it's becoming increasingly difficult to be a single-income family and still make ends meet. I know many single moms and families that have lived here for 20-plus years and cannot afford rent here any longer. They end up homeless and on various forms of government assistance despite working full-time and taking small part-time jobs on the side." So the biggest thing that stood out to me was that these young families aren't able to stay in the community that they love and that they grew up in, and they can't continue that long history of owning a house and really staying here for their family.
Okay. So I had like the developer landlord perspectives on this issue, but as mentioned earlier, housing and affordable housing in Sonoma County has been rare these last few years, and it's really affecting the millennial generation. The average median to purchase a home is $550,000, and to rent a 1-bedroom is $1,962. A lot of young millennials want to raise their families here, but with the high rent market, it's pushing people away and moving to places that are more affordable to raise their family. I got into contact with somebody from the Sonoma County Community Commission Development, and they were just telling me kind of what they were about, how they're dedicated to helping low to middle class families find homes that they can afford. So a lot of millennials are considered low to middle class, so having something like this in place already I think is really great. Santa Rosa is getting $3 million in subsidies to start construction on affordable housing, and I think something like this definitely needs to happen. On that project, 8 developers are already interested in getting this project started, so hopefully by the end of the year, 1 will get approved and they can start building these houses as early as spring 2018. A lot of the land in Santa Rosa isn't being used well either, so I think they need to utilize their land so developers can start building on houses. A place that would be good for this is the former Sutter Medical Center, Option 8. There was one local developer interested in purchasing that property and wanting to build as many as 800 new housing units. So steps like these, I believe, need to keep moving forward to help solve the housing crisis we have here in Sonoma County. And then I talked to some landlords and I asked them a couple basic questions like what kind of renters they look for. And a lot of them said good credit, proof of employment, makes 3 times more than what the rent cost. So after graduating from college, millennials aren't making that much, so it's making it difficult for them to find places to live. And when they do find those places, they are either having to have multiple roommates or their parents are having to co-sign. And then when asked how often they can change the rent on prices, answers were as expected. They can change their prices whenever they want, but it has to be after your lease is up and it can fluctuate between the tenants. Property management, so I did talk to a couple of property management and they said that they do advise against that because it makes it harder for them to find another renter who can afford the higher prices and makes it difficult for them.
All right, so I looked into solutions to these problems, and quickly I learned that there's no end-all solution. It's going to take multiple different things for there to be any headway. So one person that I talked to, her name was Annie Lee, and she's the field coordinator for the Fair and Affordable Housing Campaign. The Fair and Affordable Housing Campaign is behind Santa Rosa's Measure C, and what Measure C is focused on is reinstating rent stabilization and just cause eviction policies in the city of Santa Rosa. This measure is going to be on the ballot for June 6th if there's any Santa Rosa residents here. Annie stressed to me that Measure C is just a first step. It's a good opening to solutions that people can understand and get behind. And so what Measure C does, the reason that Measure C is a limited solution is because it only affects multi-unit complexes built before 1995. So landlords who are renting single-family dwellings aren't affected by this, or anything built after 1995 is not affected by this. And it's the two main proponents of Measure C is first to limit the amount landlords can raise rents to only 3% a year, rather than huge amounts that are being raised right now. And second, it would enact just cause evictions. So something that Annie ran into when she heard about this problem was a bunch of people getting evicted from their homes without any reason, so that the landlords could then raise their prices by several $100s. So just cause evictions would limit the reasons why landlords can evict tenants to things such as criminal activity, violation of obligations, non-payment of rent, compliance with a governmental order, things like that. I also talked to a woman named Elise Hempel from the Petaluma People Services Center. She also really stressed that we must implement a multifaceted approach for there to be any sort of headway in affordable housing in Sonoma County. And one program that Elise is involved in is the SHARE program. And what the SHARE program does is it brings together seniors who have access to housing with those who need housing. And the reason that this is really important is because then it'll help free up a lot of housing on the market that's taken up. Right now, the vacancy rate in Sonoma County is at 3%, which is why a lot of people are locked into their homes with rates rising or in places that are not suitable living conditions. So this will help open up the market to new buyers and is a solution that can help both the millennial generation and the senior generation, which are are two generations that are being really hit hard by the housing crisis. And a similar solution to the SHARE program is to ease the restrictions on accessory dwelling units, otherwise known as granny units. So there have been some changes proposed to the Santa Rosa Planning Commission that will be discussed in the next few months. Some of these changes include increasing the size limitation from 700 square feet to 1,200, which will make it easier to accommodate couples. Restricting the rental of these units to a minimum of 30 days as a way to ensure that these are being used for long-term housing rather than vacation rentals like Airbnb, which is taking up some of the market for rentals. It will also reducing the requirement that an owner live in either the granny unit or the main house will give it more flexibility to go towards renters, and lowering the high fees associated with getting permits for building granny units will really go a long ways. So these are solutions that are targeting mostly millennials and the elderly, because like I said, it's those two generations that are really being hit hard, and it's hitting students, it's hitting young families, it's hitting people that don't have access to more resources. So, thank you.
One of the unique things about this course is that students work in teams. They work in research teams. So these 5 students, and there's one more in this group, all contributed to one paper, which is going to be 25 to 35 pages long. It is now published on indiemedia.org San Francisco, and so that's part of doing this. One of the pieces of the course also is for each student individually to write a letter to the editor. And all of the students have published on Indie Media, where you can self-publish and write something, and the topics that you'll hear tonight were often what they wrote about. We had 3 letters to the editor in the PD in the last 2 weeks, and and one in the West County, I think, Gazette. So that's part of the experience of doing this. Our next group is Sonoma County Health, single-payer health, and how many people do not have health insurance in Sonoma County, even with Obamacare. Tess Von Arx, Emily Kyle, Irma Saucedo, Keith Serne, and Yoseline Cortez.
Hi everyone. Hi everyone. The purpose of this research is to understand why 20,000 people in Sonoma County still do not have health insurance, and the implementation of the Affordable Health Care Act, also known as Obamacare, how it helped lower the amount of uninsured residents. According to a study done by the Sonoma County Department of Health Services, over 62% of the undocumented immigrants have never had health insurance. The causes of undocumented immigrants not having health care insurance comes down to 2 major reasons, which include inability to afford it and not knowing how to access it. The Affordable Care Act allowed more than 50% of uninsured people in Sonoma County to gain access to health care, but still left over 20,000 residents without insurance. This is sociologically significant because everyone deserves the right to good health and having the ability to receive care if needed. Preventative care is very important, and many people in our county are unable to receive that.
So I'm going to talk about insurance specifically related to California, and with the current healthcare system, insurance companies are able to take advantage of the complexity and uncertainty surrounding choices because uninsured people lack clear information about prices, medical procedures, combined with all the insurance options put customers in a weak position. So there are multiple options when it comes to buying health insurance. The first few plans are health plans, which are HMOs, and public programs such as Medi-Cal and Medicare. Health insurance gives you coverage if you need Medi-Cal or in a hospital. According to California Department of Insurance, group policies can be purchased by your employer or an association. There's also individual and family policies, which is insurance you can buy outside of an employer or association. There's also health maintenance organizations, which are plans that can be purchased either as a group or individual family plans, but they are regulated to the California Department of Managed Health Care. Self-insured health plans are most common with large employers. Usually the employer has a large pool of money and they use that to pay for the health care of their employees, and this usually means your employer contracts with insurance companies to manage their health benefits. Medi-Cal is California's version of the federal Medicaid program. This program generally covers low-income families and single adults. It's mostly provided by managed care organizations and covers an array of medical procedures such as office visits and other health-related expenses. There's also Assistant for Infants and Mothers, which is for low-income pregnant women and their infants who do not have health coverage and do not qualify for Medi-Cal or Medicaid. And then there's also medical supplement insurance, which is designed to supplement original Medicare and can be purchased by anyone enrolling in Medicare. Covered California is a part of the Affordable Care Act, which is a health insurance where individuals, families, and small businesses can purchase products sold by private insurers. And then specifically related to healthcare programs, there are programs such as PPOs, EPOs, and HMOs. Preferred provider organizations has a network or group of preferred providers. You pay less if you go to these providers, and they are also called in-network providers. With a PPO, you can go to a doctor or a hospital that is not on the preferred provider list. However, you may have to pay more out of pocket or out of your network. And then the PPO pays less or nothing at all. In exclusive provider organizations, you usually do not use a primary care doctor. Most of the time, you do not need referrals to see a specialist who are in-network. There can be a limit on the doctor or on the visits to doctors or hospitals you can use, and you cannot go outside the network or you will have to pay for the fees yourself. And then the last one is the health maintenance organization, is when you usually have a primary care doctor. If you see a provider outside of the HMO network, they will not pay for those services except in cases of emergency and urgent care. The doctors and other providers may be employees of the HMO, or they may have contracts with them. To join an HMO, you must live in the area of the HMO. And then I'm going to talk about single-payer healthcare, because that was another thing we found that would be better for everyone if we had a solution to the current healthcare crisis. So single-payer healthcare is a system in which residents pay the state via taxes and amounts determined by the state that will cover everyone's healthcare costs rather than individuals buying from private insurers competing for their business. Overall, single-payer healthcare has the ability to be more cost-effective than other programs we currently have and would allow for all residents to receive care at a cost-effective price. The average American would be paying no more than they currently do, but they would receive more health care than they currently have. Relying on a single source of revenue for the healthcare system may encourage rational and deliberate trade-offs between cost and quantity and quality. There are three principal ways that single-payer system can achieve lower costs, and that's by first, the system makes it possible to reduce the administrative costs of organizing and delivering healthcare services. The second is that single-payer systems may be able to export power over providers if they have no alternative that forces them to accept lower payment rates. And lastly, single-payer system can centrally control the overall level of healthcare resources by constraining their availability so that they will be better able to determine the size of the healthcare system.
So I'm going to talk about the how much you have to pay in taxes if you are not covered with health insurance. If you can afford to pay for health insurance but choose not to buy it, you must pay a fee called the individual shared responsibility payment. The fee is sometimes called a penalty or fine. You owe the fee for any month your spouse, or your tax dependents don't have qualifying health coverage. You pay the fee when you file your federal tax return each year. Some cases can qualify for a health coverage exemption from the requirement. And then in 2016 and 2017, the fee is calculated two different ways. So one is as a percentage of your household income per person, which could be 2.5% of the household income, or paying $695 per adult and $347 per child. Both of these calculating tools that they use can't exceed $2,085 per year. Our interviews, some of the interviewees that we talked to were upset that they had to pay the amount, but they would rather pay the $700 each year than paying out of pocket per month for health insurance, because it far exceeds that amount over the course of a year. Specifically in Sonoma County, if Obamacare is repealed, more than 35,000 residents will lose coverage in this county, costing the county more than 2,000 jobs and an economic loss of nearly $200 million. Santa Rosa Community Health Centers covered about 14,000 residents through the Medi-Cal expansion when Obamacare was enacted. In Sonoma County alone, 35,000 adults, which is approximately the population of Windsor and Sebastopol together, obtained Medi-Cal, and after Obamacare covered adults, I'm just gonna skip that part. Overall, the county had over 100,000 men, women, and children enrolled in Medi-Cal. The uninsured rate dropped from 13.1%, which is 64,000 residents in 2013, to 6.3%, which is 31,000 residents in 2015. The repeal of the Affordable Care Act would impose a statewide loss of 200,000 jobs and 20.3 billion goods and services. And then
hello everybody. I'm going to be covering the local resources for Sonoma County. Sonoma County provides many resources for those who lack health insurance. The first is the Disease Control Unit, which is responsible for the investigation of outbreaks of communicable diseases, surveillance of reportable diseases, and provision of educational materials, along with the services to assist communities in reducing the incidence of communicable diseases. Any uninsured residents rely on these services, so these are extremely important and helpful to everybody that need them. The Disease Control Unit provides the following services: infectious communicable diseases investigation, tracking and reporting, tuberculosis case management, AIDS surveillance and HIV reporting, flu program coordination, immunization assistance, health information, and other recommendations. And this is all from Sonoma County Health Department. Children can be the biggest victims due to lack of health care. Many children go years without seeing any medical attention. The California Children's Services states that if your child has a catastrophic or serious medical condition that meets program eligibility criteria, the program may be able to provide financial assistance for medical services and coordinate healthcare services. Services include physical and occupational therapy, financial assistance, case management, and access to specialized medical care. The key to this is your child must be under 21 years of age and your family income must meet certain eligibility guidelines, and only certain conditions are covered. With normal healthcare plans, the eligibility of these services include, again, you're under 21 years of age of the child, and the family income must be less than $40,000 a year. A child whose family has a higher income may receive services if the estimated cost of medical care in 1 year is expected to exceed 20% of the family income. And as far as the methods used for this research, our group and I, we conducted 12 qualitative interviews with local residents in Sonoma County who are uninsured. And the three people I interviewed were three people in their early 30s. And they told me that the biggest reason why they aren't covered is for two main reasons, which is their employer doesn't give them the opportunity to be insured. That's not offered to them. And secondly, there's lack of income. They just feel like it's not a high priority in their life right now. So, early 30s, I hope to be covered early 30s. So, they just maybe as they get older, they will grow higher on the priority list.
And then just a few of the interviews I did was with the food industry workers, and most of them highlighted that they just honestly can't afford to pay for their own insurance, but because they work multiple minimum wage jobs, they're not eligible for insurance, like he was saying. So that's like one of the main reasons why they don't have insurance. Some of them wish that they could just pay out of their checks, like a portion of it, and then their employee would fill in the rest that they can't afford. Both of them also highlighted that they wanted to have vision was more important to them than just healthcare in general, because they both have glasses, they need checkups, everything like that. And they're both in their late 20s, so they feel like they're invincible. They don't need insurance. It's not top of their priority list. And then also both of them, they would wait until if they got sick or had issues, they would wait until it got so bad that they would have to go to the emergency room because they didn't have the money to go to clinics and things like that. So they would just be left with these insane bills from the hospitals, and they usually just let them go to collections because for them it's paying for rent and food and just to live and survive. So for them they're not worried about those bills. They just hope that they're not keeping them. They just, so hopefully they, for the future, they hope to get better jobs that allow them to have insurance through their employer.
Okay, so going in contrast with that, one of our group members, she did interviews on undocumented families, undocumented people. What she got out of it was that most of them can't afford it, and most of them are afraid to actually even go to a clinic and say their personal information about it. On contrast to what she said, some of them do wish that they had the opportunity to get an insurance by where they work at. One of them said, "I wish I could just pay a little out of my checks to get insurance, but they have other bills to pay." So basically, what the undocumented people that she interviewed, they spoke about how they have other bills to pay besides their insurance, and besides they don't they're feared to even get it. I interviewed personally, it was supposed to be a hospital administrator, but unfortunately we didn't get in contact with one of them. So what I decided to do was just to speak to a doctor, and in my interview that I spoke to him, I asked him a few questions about what he felt about healthcare, and in general what he felt what could be a better healthcare for many people that come and see him. And he said that a single payer will be the best thing for everybody to have insurance. He also said that what the main issue that he sees with his patients is that since he can't take care of them, he transfers them out to another clinic or another physician, and they can't afford to pay it because of the co-pays. It's a co-pay to see him, and then it's a co-pay to see another doctor. So he says that the better way to go is just for everybody to be able to have affordable health care, or to have for everybody to have a health care.
Well, as you can tell, they've been working very hard. Because these are group projects, I often get asked, well, how do you grade them? Does the whole group get the same grade? And one of the things that each student does is keeps a journal during the class. So that's how we individually evaluate what their involvement has been, their research and their ideas, and so they turn those in. And our TA, Monica over here, has been saying that they're looking pretty good this year, so I'll be happy to give lots of A's. Our third group is on immigrant rights in DACA, sanctuary cities, and it's Kimberly Bravo, Nicole Wilcox, Jorden Steger, and Cinthia Junco.
So hello. The purpose of our research was to explore how students and non-students under the deferred action for childhood arrivals are socially and economically affected by the new immigration policies under President Trump's administration. We will discuss the history of DACA and how it became the policy it is today. And since the mental health impact is often overlooked, we'll investigate how it impacts students and non-students' personal, physical, and mental health. Lastly, we will research the activism our community offers in order to support these DACA individuals. In order to achieve this, we will be using, we used in-depth interviews with DACA recipients and those who associated with them. According to America's Voice, a poll released in late November found that 58% of voters supported keeping DACA in place and just 28% wanted it repealed. And so some history of DACA. From 1942 to 1964, the Bracero program began the big migration of Mexican laborers to permit them to work in the United States in return to fulfill the supply and demand in the economy. Later in the 1980s and 1990s, the federal government made changes in immigration, which caused a large influx in immigrants to settle down on U.S. soil. Then, 11 years later, the Development, Relief, and Education for Alien Minors Act, the DREAM Act, is introduced to create a pathway for citizenship for children who unknowingly cross the border without documentation. With failed attempts over the years to pass through Congress, on June 15, 2012, President Barack Obama established his executive order of the Deferred Action for Childhood Arrivals, DACA. The goal was to prevent further deportations on over 1.2 million undocumented youth who comply with government guidelines to consider them lawfully present for a renewable 2-year worker's permit with a social security number. This is the first time in the U.S. history when an immigration policy was a direct result of advocacy efforts led by the very people who would eventually benefit from this policy. This policy shift is a major accomplishment and a significant step in the right direction in the struggle to allow young people in the United States without a legal status to reach their educational and career potential. The Obama administration has responded to the cries of so many people raised as Americans, educated in our schools, wanting to positively contribute to society. This new program is a reflection of the power that our undocumented youth have to affect change. Since its launch, DACA has provided a 2-year reprieve from deportation to work legally in the United States to more than 728,000 unauthorized immigrants who came to the United States. On July 20, 2015, 16 legislators opened in-state tuition policies to DACA students, in which 5 of them allowed financial assistance. While eligible immigrants enjoy the benefits of DACA, improving the United States gross domestic product, they must also comply with current taxes and contribute to the tax revenue. DACA promotes better economic mobility, higher education, and improves relationships among communities all over the country. However, with the new government and administration, fear and anxiety has spread throughout the United States, affecting the mentality and well-being of students and non-students for their future. The United States Citizenship and Immigration Services has accepted 844,931 DACA applicants as of June 2016. The primary country of origin of DACA participants is Mexico. Individuals from 24 different countries have also applied for this program, and for California, the total eligible population for DACA is 561,000 people. There are 15,000 people eligible for DACA in Sonoma County, and the total number of the unauthorized population in Sonoma County is 29,000 people. With the election of Donald Trump, the future of DACA is uncertain. He had stated during his campaign that he intended to terminate the program upon entering office, but yet has to officially follow through.
I'm going to talk about some of the mental and emotional challenges undocumented immigrants face. So Donald Trump's administration has affected the mental health of a lot of immigrants. According to a Press Democrat article called Participants in DACA, Immigrant Driver's License Programs Fear Reprisal from Trump Administration. Raina Bays, a marriage and family therapist located in Guerneville, describes how she has begun to see the unique emotional and psychological symptoms local undocumented immigrants are experiencing over the president-elect Donald Trump. She sees a lot of fear and panic attacks. She also sees a lot of children who are not wanting to go to school because they're afraid their parents won't be there when they come home. Bays predicts an increase in anxiety disorders and panic attacks. She also explains how this type of uncertainty is very bad for mental health and well-being. According to a Huffington Post article called A Confusing History, last time Donald Trump talked about this issue was in February 2017, and this is what he stated. DACA is a very, very difficult subject for me. Yet you have these incredible kids in many cases, not in all cases. In some of the cases, they're having DACA and they're gang members and they're drug dealers too. I have to deal with a lot of politicians, don't forget, and I have to convince them that what I'm saying is right. And I appreciate your understanding on that. The DACA situation is a very difficult thing for me, as I love these kids. I love kids. I have kids and grandkids. And I find it very, very hard doing what the law says exactly to do. And the law is rough. It's rough, very, very rough. So yeah. In another article called My Life as an Undocumented Immigrant, describes a student named Jose Antonio Vargas as growing up, being undocumented means living a different kind of reality. It means going about my day in fear of being found out. It means rarely trusting people, even those closest to me, with whom I really am. It means reluctantly, even painfully, doing things I know are wrong and unlawful. He talks about how anti-immigrant rhetoric, such as the term illegal aliens, intensifies his anxiety. The current president of the United States has used the term aliens to talk about undocumented immigrants. In the article, he describes all the obstacles he had to face while growing up with little support. He says, "This deceit has never got easier. The more I do it, the more I feel like an imposter. The more guilt I carry, the more I worry that I will get caught. But I keep doing it. I need to live and to survive on my own, and I decided this was the way." He also describes how he missed a lot of rites of passage American teenagers go through, such as applying for college, first job, getting a driver's license. He kept jumping through hoops to achieve his dreams. He explains how excited he was to get an internship in the Seattle Times. He explained that this legal status, I'll skip that. However, he kept telling himself, if I work hard and contribute, things will work out. In his mind, hard work, self-reliance, and the love for his country, which he calls his, would get him his citizenship. So now I'm going to talk a little bit about some interviews that I did. We didn't want to just interview DACA recipients, but we wanted to also interview those that benefited from DACA, because you don't have to be a student. So some of the benefits of DACA include getting a driver's license, a work permit, and then applying for school, which doesn't cover, you can't apply for financial aid because that's through the federal government. So what they did is they applied for the DREAMER Act, which they can get tuition, in-state tuition as opposed to out-of-state tuition. So some of the interviews that I did, most of them described how difficult it was for them to reapply for DACA every 2 years and how expensive it was, because it's for each application time you do it, it's $495. So, I mean, especially most of these interviewees had families and children to take care of, so it outweighs, like, they're not going to apply for DACA, they're just going to support their families. So yeah, that's it for my part.
Okay, so in researching DACA recipients, I specifically focused on activism and advocacy in relation to DACA recipients and undocumented youth. So I'll start with advocacy. So because we kind of focused on students, I'll be talking about mostly the Sonoma State campus in terms of what they have to offer in terms of advocating for undocumented students, the CSU system as a whole, and then campuses that I think might serve as a model for having robust support systems for the undocumented. So Sonoma State can do better, to say the least. So Sonoma State does not have kind of any centralized, coordinated support system for the undocumented. They kind of have individuals throughout the faculty and administration who are trained to be able to help undocumented students, but there is no place where undocumented students can go on Sonoma State campus that will kind of take them all the way from, the application process to graduation. That's a problem. So the CSU system has no kind of comprehensive requirements for its campuses in terms of supporting the undocumented. If you go to the website for undocumented students on CSU, they kind of they basically have links to whatever the schools have in the way of undocumented students in support. There's nothing there. The CSU campuses basically vary in terms of having very little to support undocumented students, and then some campuses, are much better. So one model in California for a campus that really supports its undocumented students, and I'd say protects them and advocates for them, is UCLA. And they have very comprehensive services. They have things such as helping prospective students apply to the school, information about financial aid. They have all the basics. One of the things that I really found interesting is they provide comprehensive legal services for undocumented students. So that includes everything from, applying to DACA, green cards, university visas, and even detention and immigration enforcement. And I think that's in addition to that is the family of any undocumented student who goes to UCLA is also allowed to access those services for no cost at all. And I think that's a really important thing because while DACA is a positive development for the undocumented, it's a positive development for only a certain segment of the undocumented population. And what a program like that on UCLA does is brings together two groups of undocumented people and kind of basically the undocumented students at UCLA become a proxy for reaching out and helping other undocumented people in the community. So as far as activism goes for DACA, it obviously, DACA did not come about out of the goodwill of Barack Obama or, the Democrats or politicians. It took pressure and activism and lots of hard work, which was it was successful for the most part. The only problem with it is there were some deficiencies to the strategy, and one of those was leaders of kind of the movement for undocumented youth to gain more rights wanted to create in the public mind this image of undocumented youth as being kind of productive, assimilated, people who, through no fault of their own, had come to the United States and thus deserved, some leniency unlike other undocumented people. So what it did is kind of put the undocumented youth, they had to define themselves at a very narrow role in order to gain sympathy from the American public, so something like DACA could receive popular support. And this was successful, but what it did is it alienated a whole segment of the undocumented youth and undocumented in general who maybe didn't fit into this role of being a college-bound, law-abiding, undocumented youth, So what we have now is we've seen that even DACA students, DACA recipients have been gone after by immigration enforcement and ICE on occasion. So I think what we can take from that is when you have an administration that is very reactionary, they don't understand the nuances between good immigrants and bad immigrants. They paint them all with the same brush, despite what Trump has said. To the contrary. And I think that's problematic because not only does it kind of divide the undocumented community, it ends up kind of creating this image of the model undocumented youth. Alienates a lot of people from activism or the movement who think that maybe it doesn't apply to them. So I'll just kind of read my op-ed that I have yet to publish, but it kind of talks more about this. So all undocumented immigrants who have made the U.S. their home deserve amnesty and the rights afforded by citizenship, even the bad ones. For those that support the rights of the undocumented and immigration reform, we need to move beyond reference to the model immigrant in our defense and advocacy for this marginalized group. It's counterproductive. When I say model immigrant, I mean the gifted, diligent, undocumented youth making their way through college, or perhaps the day laborer who supports his family through backbreaking manual labor. These types of undocumented immigrants undoubtedly exist, but they are not every immigrant. Some of them are not productive, law-abiding people, just like some U.S. citizens. It doesn't matter. This may be shocking to some, but whether or not someone deserves basic rights such as employment or freedom of movement should not be contingent on whether they are perfect, upstanding members of their community. So that's kind of what that kind of mentality is what I kind of tried to bring into my research of DACA recipients. So yeah.
Well, thank you very much to the Petaluma community. I see a lot of familiar faces for coming out. We'll be doing this again in December for a new group. Are there any questions that people would like to bring up at this time? The question is how many people in the group might plan to be becoming a journalist, although this is not a journalism course. But is there anybody? This is a sociology course entitled Investigative Sociology. You know, journalists are just sloppy sociologists. Yeah, right. Any other questions? Well, thank you very much for coming.
Thank you.